All right, so we're trying to look at a very important, funny enough, is the most important point in radiology. Okay, so in radiology, you're not just trying to image the patient and expose them to whatever radiation energy, but you are trying to ensure that the patient is safe. And everything that is done throughout a radiology procedure is done primarily toward the interest of the patient. Okay, so ensuring the patient's safety and well-being during a radiology procedure is actually one of the fundamental responsibilities. Okay, so what are the key aspects of this? You are trying to protect the patient from radiation and ensure that the radiation that the patient is being exposed to is just what is needed, not extra. Do you understand? So applying the ALARA principle, you're using calibration to now direct the X-rays to the site of interest. You want to provide gonadal shielding so that you want to protect them from the reproductive. You want to protect the reproductive organs from the exposures. So patient identification and consent. When the patient comes there, you have to verify that okay, this is actually the right patient for the right procedure, and you have to also still ask them for permission. So infection control, you are trying to make sure that everything around the lab is actually very neat, because you don't want the patient to pick up infections from there. You don't want the radiographers to also pick up the infections from there. Patient comfort and communication, you're just ensuring that the patient is comfortable throughout the procedure. You're trying to calm down the situation if a patient is anxious. So position and immobilization, you're trying to position the patient correctly and trying to make sure that during the time of imaging the patient doesn't move, so that you get crystal clear images, so that there's no need for you imaging the patient all over again. So monitoring and emergency preparedness, the radiographer has to have good knowledge of handling emergency situations, because you could bring a patient and it's not for imaging, but you have some emergency issues coming up, you must also handle that. So post-procedure care is you have to ensure that the patient is stable before leaving the room. You have to provide clear instructions if there's need for any clear instructions to be given to the patient.